Right. So now when we go on to this particular X-ray, I've seen this one come up a lot. Where everyone umming and ahhing, and fair enough, you're probably going to end up going to get a CT scan because you're not entirely sure what's going on. But this patient fell on their right side, as now having difficulty moving, and they're saying it's shorted, etc., etc. So what the trick really is, so what I found a lot of the time is that people will do all the right things by drawing around the pelvic brim, make sure that's all kind of nicely aligned, draw around the femoral heads. But what you really also should do is draw around the lateral femoral neck, the internal, kind of more medial femoral neck, the greater trochanter as well. Once you've done all the drawing, the next thing to do is to take a really big zoom in. Yeah, well done, you picked it up, I can see that. And have another look at the trabeculation. And you can see that this kind of all diagonal like this, right? And that's normal. If you have a discrepancy in that diagonalness, if that's a word, then you're probably looking at a fracture. The other thing that I've seen people not realize sometimes is that there is this cortex, right? Sometimes you get lesions that cause a bit of scalloping of the cortex as well. So very, very important to pay attention to the texture of the bone and also the trabeculation of the bone. And like someone has spotted very well, is that there's more than likely going to be a fracture of the right neck of femur. Because if you look at the other one, there's nice trabeculations, that diagonal lines going across one another. But here, on this particular occasion, you can see that there is an increased sclerotic appearance to this area over here. Yes, you do have some normal trabeculation, but it all seems to kind of culminate to this area over here. And even more importantly, as you come up to this area, you can see that there is a bit of a step deformity there. And this whole area doesn't look quite right, especially when compared to the other side. So what you actually have here is not only a neck of femur fracture on the right side, it's an impacted neck of femur fracture on the right side, which, believe it or not, does get missed. And I will show you, I've got some really great cases of bone lesions, et cetera, that will kind of help us understand the whole thing. I'm talking about the trabeculation, the bone density, and the bone texture as well as time goes on. You may spot that this person probably a bit of a repeat offender because there is this increased appearance of cortication within this region. And that may be secondary to a previous fracture that has since healed. So something to be aware of. This patient's probably had a few unfortunate incidences of falling over. Right, so I think maybe this could be, again, it depends on what stage you're at in your training and learning. This may be a bit of a challenge for some of you. So if you can see the abnormality, do feel free to throw what you think it is. I will be impressed.